Hi there, I'm Dr. David Haase with the MaxWell Clinic, and I'm really passionate about creating health. And I started my medical adventure at Vanderbilt, going to medical school there and on getting residency and training and practice at the Mayo Clinic in Rochester, Minnesota. And from there, I've gone on into really a quest of what does it take to create health? How can people have a greatest vitality and experience in their life? And it's led to a 20 plus year career in looking for tools and capabilities that help people overcome their barriers and can do so long term to experience higher levels of vitality and joy, while at the same time avoiding the pain of degeneration and early disability. And our mission is something we've worked on for a long time, and we really mean it. Our mission is that we exist to wholesomely transform the health of humans and healthcare systems by creating a haven for called healers to discern and deliver what's wise and works to maximize human potential and well-being for every sacred seeking person that we serve. And we actually mean those words. We were very focused on how can we create an environment by which every patient, when they walk through the door, knows that we care about our people. We have the most amazing people in our facility that care and want to be a part of seeing other people get better. And that's what I call a healer, is that almost everybody that's come into healthcare does healthcare because they have a desire to have other people thrive and be well. And that instinct of healing is something that we try to encourage and elevate because we think it really makes a big difference when people are suffering. Wow, what I am so proud of is how we focus at underlying cause. One of the things that we love is our ketamine program. And we have an amazing group of individual psychotherapists and spiritual counselors and people that in the medical arena that are all focused together to help individuals break their dysfunctional patterns and lift themselves out of depression. We've seen individuals have really remarkable results with regard to when they start to get beyond themselves. And the tool of ketamine is one of those things that has really been a groundbreaking addition into what is a very robust and complete clinic system as it exists already. One of the major mistakes that we see people having made, because a lot of people find their way to our clinic after having not had success elsewhere, is that they're often not being heard. They're often not being allowed to be understood as a whole person. And even when individuals have done a lot of research and they say, wow, I want to have this particular therapy, it's good to come to a place that doesn't only have one hammer, right? One of my ongoing problems is that if your only tool is a hammer, everything becomes a nail. And I will tell you that ketamine is one of the most amazing hammers I've ever seen that has an opportunity to change many, many lives. But if that's the only thing that a center does, if that's all they really hang their hat on, then the patient actually has to become the doctor. The patient says, oh, I've done my research, I want that. And then they miss out on the opportunity for clinicians to step back in the context of other clinicians. There may be experts of the body, of the electricity of the brain, of the psychological aspects of the brain, spiritual aspects of the brain, knowing that the therapy that you're going to engage is the best therapy for you at that time is made more possible when you work in a center that has multiple therapies available. And you select from those that are going to give you the most likelihood of having long-term benefit. how do I make the initial connection with somebody who's struggling? Well, the first thing is to take a deep breath. The first thing is to take a deep breath, and as a clinician, to gather myself, to recognize that I'm in the presence of really a sacred being. I'm in the presence of somebody who is infinitely complex, has a remarkable ability to heal, and is here on this earth for a very specific purpose of which I can't even begin to understand. And they are suffering, and they are suffering. And so to have compassion, it is important for us to each individually know that to remember the pain that we have had, and to be open to listening to whatever that person needs to say, because that person is an expert on them. They're the ones that know what truth is. They're the ones who know what their experience is. And so we gather ourselves and we listen, and then exercise compassion, and then apply curiosity. What could be going on? And then where it's reasonable and rational, and provide hope, provide options for how could they look at this situation differently? And where else could we potentially find solutions where ones have not been found before? And everybody needs hope. And the good news is that hope is not irrational. Our bodies are designed to heal. And most people, when they have been suffering for so long, they've forgotten that. They've forgotten how, wow, if they cut their arm, it just knows how to knit itself back together, right? Our cells know what to do. When we have an emotionally traumatizing circumstance, for the most part, we figure out how to move on and get through the next day. And so it's part of what we really try to remember is, what pain have we had? What is our journey, and how does that inform where we go? And to have compassion for the infinitely unique path that person has had, leading them to that conversation in that moment. If I could transform anything about the mental health space, I would reframe it as the brain health space. Because if we just step back for a second and realize that this 2.5 pounds of mush that's sitting up here in our cranium is really where all of it's going on. And then we can say, wow, it's my brain, it's not my soul, right? I am not, when we say I, the meaning, our understanding of ourself, I am not broken, but my brain is struggling. And if we do that, we can start look at the brain in a different way. We can do quantitative EEG and potentially do neurofeedback. We can be curious about all the biochemistry that is inside that person's body and how it feeds, nourishes, or inhibits the brain. We can think of what type of counselors are there to help an individual, or we can reach out to therapies like ketamine that can give an individual an opportunity to break out of recurrent or treatment-resistant depression, severe anxiety, and trauma that has occurred in their life. We have that capability to step back and apply what we need for that individual. And that all comes from seeing it not as mental health, but brain health. And then you think, what kind of a setting is that brain going to live in? Is that brain in a safe space, right? Is that brain surrounded by family members that care for them? Is that brain getting enough sleep? And it's so interesting to us when people make that jump, they are open, and all of a sudden their minds explode that, wow, I have so much more potential for healing than I imagined I had. And they also feel so much less shame and guilt about the symptoms that they feel. And to overcome that shame and guilt is one of the first steps to breaking through the denial. and to taking, contemplating a new action and taking a new action and moving forward. So that's what I would change.